Good day everyone, I'm Jirah Sarmiento and I will be doing NGT feeding. So for the assessment, doctor's order, client's level of consciousness and level of knowledge and understanding, availability and functionality of the needed materials, for any clinical signs of malnutrition or dehydration, for allergies to any food in the feeding, if the client is lactose intolerant, check the tube feeding formula, notify the primary care provider if any incompatibilities exist. For the planning, before commencing a tube feeding, determine the type, amount, and frequency of feedings and tolerance of previous feeding. Next is the equipment. First, correct type and amount of feeding solution, 60 ml catheter tip syringe, a meses basin, clean gloves, pH test strip or meter, large syringe or calibrated plastic feeding bag with label and tubing that can be attached to the feeding tube or filled bottle with a drip chamber, tubing, and a flow regulator clamp. Measuring container from which to pour the feeding if using open system. Water of 60 ml unless otherwise specified at the room temperature. And lastly, feeding pump as required. For implementation, prior to performing the feeding, introduce self and verify the client's identity using agency protocol. Explain to the client what you're going to do and why it is necessary and how he or she can participate. Inform the client that the feeding should not cause any discomfort but may cause a feeling of fullness. Perform hand hygiene and observe appropriate infection control procedures, example, clean gloves. Provide privacy for this procedure if the client desires it. Tube feedings are embarrassing to some people. Assess tube placement. Apply clean gloves. Attach the syringe to the open end of the tube and aspirate. Check the pH. Allow 1 hour to elapse before testing the pH if the client has received a medication. Use a pH meter rather than pH paper if the client is receiving a continuous feeding. Follow agency policy if the pH is equal to or greater than 6. Assess residual feeding contents. If the tube is placed in the stomach, aspirate all contents and measure the amount before administering the feeding. Administer the feeding. Before administering feeding, check the expiration date of the feeding. Warm the feeding to room temperature. For the rationale, an excessively cold feeding may cause abdominal cramps. Clamp the feeding tube. Clamp the feeding tube before all of the water is instilled. For the rationale, clamping prevents air from entering the tube. Ensure client comfort and safety. Secure the tubing to the client's gown. For the rationale, this minimizes pulling of the tube, thus preventing discomfort and dislodgement. Ask the client to remain sitting upright in a Fowler's position or in a slightly elevated right lateral position for at least 30 minutes. For this rationale, this position facilitates digestion and movement of the feeding from the stomach along the alimentary tract and prevent the potential aspiration of the feeding into the lungs. Lastly, for the evaluation, evaluate the patient's response to the procedure. Document the procedure and other important data on the client's chart.
Good day, ma'am. I'm Jirah Sarmiento, student nurse from Nasogastric University of Science and Technology. So ngayon po, papakainin ko po kayo through NGT. Hindi po siya masakit, makakaramdam lang po kayo ng pagkabusog. Okay lang po. Ano pong pangalan nyo? Kayo po si Jirah. Sige po. lang po tayo ng 30 minutes na rin para po bumaba po yung pagkain. Okay po?